purpose of the Rural Healthcare Discussion Series is to create a forum for members of Texas rural funders and healthcare state agencies, organizations, and entities to have regular conversations about rural opportunities and needs in the healthcare space. Today, I am very excited that we have representatives of the Marathon Health Center here with us. We have Danielle Gallo, the manager of the Marathon Health Center, and Sandy Devers, who's a community member and an incoming board member for the health center. So I had the occasion to go with some members of Texas Rural Funders recently on some site visits in West Texas, including the Permian Basin Area Foundation, and got to visit the health center, which has grown from an idea to an actual full-fledged clinic. And so today we're going to have a tour, but I want to, before we do that, turn it over to Jennifer Stedman from Permian Basin Area Foundation to talk about their involvement in supporting the Marathon Health Center. Jennifer?
Hi, thanks, Kelty. Like Kelty said, I'm Jennifer Stedman. I'm the development officer here at the Permian Basin Area Foundation. We annually take our friends from the Stillwater Foundation down to rural West Texas. And Ellen or Guy should probably really give this intro. I know Guy is actually down in Alpine and Fort Davis right now, so he's unable to hop on this call. But we've been taking our friends down there for a while, and Guy has really had a long time relationship with lots of folks in the Marathon community. But our granting relationship started with them in 2021 with both Permian Basin Area Foundation grant dollars and Stillwater dollars. We worked with Marcy Roberts, who is a community member in Marathon, and had this idea and saw the need for a health clinic in that area of West Texas, far rural West Texas. And so we worked with Marcy, and Marcy was just dynamite and came up with this plan and had supportive community members, and they had a building, and so we helped fund kind of the remodel and retrofitting to make it into the clinic that it is today. And since then, even before then, it took off. It's just a wonderful resource for that community and the other even smaller communities surrounding it. And so we've made grants since then for just general operating and to keep that clinic going. We met Danielle in her new position when we were down there, I guess it was in January this year. And so we just think the world of the foundation. We trust them in what they're doing at the clinic, and are supportive of all the new and innovative ideas. It's really become kind of a prototype, and they've worked very closely with Texas Tech to really innovate telehealth and telemedicine in a fascinating way. And I'm so glad that Danielle's here to show you the clinic and just so y'all can learn more about how unique this opportunity is down in Marathon.
Thanks, Jennifer. So Danielle, we'll hand it over to you.
Hello, everyone. Thank you, first of all, so much for having us in to show you around today. It's very exciting for us to have visitors, even if they're virtual ones. I'm Danielle Gallo. I've been a resident of Marathon since 2002. And my position here at the health center as manager began in July of 2023, so not all that long ago. Previous to that, I was a board member. And I want to tell you a little bit about my background. I am not a clinician of any kind, but I do have a degree in clinical exercise physiology and nutrition. So my passion is lifestyle medicine, but much closer to home for me, I have a huge passion for seeing my community thrive. And our health center initially began in 1995. We were gifted the building, I think, by the Veterans Association, and it housed over the years a lot of different permutations of a rural health center. And it was usually like a little satellite of either Big Bend Regional Health Center, Pecos County, whoever we could get to send us doctors and nurses, and it functioned exactly like a rural health clinic would. Unfortunately, it's really difficult to make that model work in a town of about 400 people. It is not a profitable enterprise, and staffing difficulties and the distances involved with our clinicians having to travel from Fort Stockton or sometimes Midland, Odessa, made it really untenable. So when we lost our last contract, which was with Pecos County in 2017, Marcy, who's still our board president, came up with this idea of saying, well, let's just cut out all of the middlemen. And she went to Texas Tech and said, we want to have a telemedicine clinic, but we want a real telemedicine clinic. So we're very excited to show you around today, because what we've developed here is a hybrid of all of the resources that are available to us. Texas Tech telemedicine, remote and in-person mental health services, exercise and nutrition education, and anything else that we can pull on from our local resources and our area resources to provide high quality, affordable, and accessible healthcare in the middle of nowhere. So I want to introduce my colleague, Sandy Devers. Sandy spends half of his time here in Marathon from his home in Scotland. The other half of the year, he's over the pond. And we're very excited to have him coming on as an advisory board member. So I'll let him say hello. He's going to be our cameraman today, so you all can take a virtual tour with us.
Thank you, Danielle. I hope you can hear me okay. Yeah. So I was CEO of a non-profit in Scotland that supported people with mental health problems and people with learning disabilities. And prior to that, I was an advisor at the Scottish Government for health and social care improvement and better outcomes for patients and users of social care services. So coming from a place where we have the NHS, it's just absolutely fascinating for me to see how the healthcare system works here or doesn't work. But I'm particularly excited about all the innovation that's going on here in Marathon, and that's why I volunteered to become an advisory board member. So I hope you enjoy the tour.
So Sandy is going to start, I think, at the front of the building. Give him a minute to get his camera ready. There we go. Just to let everybody know, our regular Thursday yoga class is just finishing up. They've all given their permission to be on camera in case we catch any of them, but we have a bunch of folks in there stretching at the moment. But here's the outside of our building. It's on South Main Street in beautiful downtown Marathon, Texas. Those are the train tracks and the Gage Hotel across the way. And then we'll go ahead and pop inside. We're very fortunate because Marcy Roberts is an amazing design architect, and her husband, James Evans, is a renowned photographer. And the photos that you see all along our corridor here are all locals. Anyone from Marathon will instantly recognize any of these folks. Some of them are no longer with us. A lot of them still are, actually. So we wanted to give the building a really welcoming feeling. For people to come in and feel at home, feel like it's recognizable. That's Hallie Stillwell and her daughter, Dadey. She was one of our sort of founding families and a great matriarch of our town. So we'll move down the corridor. This is our primary examination room, and this is where we do our telemedicine. So we have a blend here of new technology and traditional, probably 1980s era from other iterations of our health center medical equipment. So in this room, you can see we have this monitor, which was leased to us by Texas Tech University for our use. And it has some special equipment on it. Ordinarily, you would see your face when the camera's just on, but I've set it up here to be hooked into our digital otoscope. And Sandy is going to show you how this thing works. You can see there's an attachment down there and a big attachment here. And with this instrument, you can look at someone's eardrum, down their throat. You can look at their skin, their eyes in amazing detail and high resolution. The doctor can freeze frame and zoom in. And it's an incredibly useful diagnostic tool because they can actually check and see if you have an ear infection or an eye infection and diagnose it accurately. We got that instrument as well as our digital stethoscope, which the doctor can use to hear heart and lungs for a patient, so that they have that sort of extra tool that allows them to see what's really going on. They can differentiate between an upper respiratory infection and pneumonia over a computer from Odessa using that stethoscope. So really useful. We decided that because so many of our patients are chronic disease patients, that we wanted to do some diagnostic testing beyond just being able to listen to a heartbeat or look down a throat. And what we did was we started doing point of care lipid panels, A1C tests, and blood glucose tests. So I can take a full lipid panel with a single finger prick. It's a CLIA waived test. So we got a CLIA waiver, which is an FDA approval process. And that enables us to do point of care diagnostic testing of that kind. So people can come in Marathon and quarterly, they can get a free full cholesterol panel and A1C test and kind of track their numbers. And because my background is in lifestyle medicine, I'm also able to dispense nutritional and exercise advice, which they can then track to see if they adhere to it, if it's working for them to improve their numbers. So this is our main exam room, and then we're going to go down the hall. We have a restroom here. Our yoga class is just clearing up, so we'll probably let them clear out, Sandy, and then we'll look at the gym. This next door is our secondary exam room. And as you can see, like I said, I just took in a whole bunch of donations last night in the middle of a rainstorm. But we have a library here of wheelchairs, walkers, crutches, knee scooters, slings, boots, massage guns. And we call it a library because people can leave a $20 deposit, check out whatever they need, and then return the item and get their money back when they're finished using it. All of those donations, actually, I'm hopefully going to be sharing with the Sunshine House. They came from an occupational therapist in Austin who was passing through the area. So we've got all kinds of PPE and new equipment to share with the region as well. And over here, we have some brand new toys that are very exciting for us. This is our Quest Diagnostics centrifuge and all of its accoutrement. We just set up our account with Quest, and we have a volunteer phlebotomist who comes about once a month to do a blood work lab. She can do the blood draws, fill out the paperwork, send everything into Quest, and then the results come straight back to the patient or the patient's primary care physician. The difficulty with getting lab work accomplished when you live so far from everything is we thought it was something that was insurmountable, but we've managed to sort of cobble together a workaround. And here what Sandy's showing you are some testing kits for flu, RSV, and strep throat. And we also do COVID. We just through using the telemed system, it started to get frustrating when people would come into the clinic and the doctor would say, well, you might have strep throat, but you have to get a swab done. So the primary motivator for us getting a CLIA waiver that would allow us to do this diagnostic testing was so that the telemed appointment would be all the patient needs. They would just need the telemed appointment. The doctor can make an accurate diagnosis that's scientifically backed up, and then they can just call in the prescription to the pharmacy. And it's a huge time saver, money saver. The lab work as well, it can sometimes take 3 separate doctor's appointments, first a checkup, then a lab appointment, and then a third appointment to go over the lab results. Whereas now they can have a lab order sent to us, get their blood drawn here, get the results in here, and meet with their doctor over telemedicine. And it is a big difference, especially to uninsured patients. So this will be weird. I hope this doesn't echo This is me. Hello. This is our counseling room. And we have sort of hybrid counseling here. It started out as being remote counseling. We have linked with TT Chat, which is part of the Texas Tech sort of family of services, and it allows any school child that's enrolled in the school to get access to free counseling. And that's amazing. But we also have an in-person counselor who comes once a week. She'll be here this evening, actually. And she works with a lot of children, as you can see. We have Legos and art supplies and things that she stores here. So she can come in person and see patients. We also allow any community member to access this room at no charge if they have their own counselor that they see remotely and just don't have a private place to meet with them. So that's what this setup is over here. And this is my little kitchen. I like to make tea for patients when they come in, so we drink lots and lots of tea around here while we're waiting for the doctor. This is our bodywork room. So this is a nice electric massage therapy table that's adjustable. Our postmistress is a massage therapist, and she will come and give just a 30-minute corrective massage to locals who really need one. It's affordable and accessible. Any practitioner can use this room. We only ask 10% of whatever a private practitioner charges their patient just to help us keep the lights on, but it's accessible to anyone. And part of the reason for that is because the original vision for this facility was to be as a conduit for healthcare. Sort of we're going to build the building so that people that have skills or have certifications don't have to pay the overhead that they can't necessarily afford, but we still get the services. And that enables people who might live in Alpine or even further away to come and let us benefit from their expertise and their income benefits as well. So this is my messy little office. There's room in here for several people to be tapping away at any given time. That's my lunch. Sorry. I'm a vegan, so thanks, Sandy. Appreciate that. And we have something really special out the back door here. It's a nice yard, but we built a resident apartment on the back of this building specifically so that clinicians and visiting practitioners can have a place to stay when they're in Marathon. So, for example, a doctor or a nurse or a physical therapist or somebody who knows how to train people in CPR can contact me and we'll allow them to stay in this room in exchange for services in the health center. We have used this so far for things like medical students on rural rotation from Texas Tech, where they're coming down and working in all of the area clinics. They get to stay here and then they don't have to have that enormous drive to get back home. So they can come and be here through the week, through the weekend, take advantage of the national park, and we get the benefit of their experience. This is also available to the community as well. If folks have family coming in, it can be really difficult to get a hotel room or an Airbnb. We charge $60 a night for people just to rent it. So now that it's empty, Sandy, let's go ahead and show the community room. There are very few accessible indoor spaces in Marathon for meetings or clubs to get together. So we made this community room and we put a little gym into it. So locals can have a membership for $15 a month. We have our yoga classes here and we do circuit training 3 times a week. There are exercises on the wall and there's a great big internet-enabled television so you can come in and put on your favorite workout or bring your friends and do Zumba. This is also where we hold our free clinics, which we have about 3 or 4 every year. And they get usually 6 to 8% of the population come out for health screenings and other clinics. We've got one coming up March 13th, actually, so that'll be in this room. That gym membership gives members 24/7 access to that side door there as well, so they can use it on their own schedule. And if you go out that door, Sandy, don't close it behind you because it'll lock. There we are. So that's the Marathon Health Center. I think, Evan, if you want to stop spotlighting Sandy's camera, I want to talk just a little bit about how we've come to where we are right now and what our current needs are and our goals for the future. And then I would love to take your questions. So like I said, 2017 is when we first started thinking of turning over to telemedicine. And it really happened maybe a year and a half ago in its first iterations. Thanks so much to Marcy Roberts in particular, the Marathon Foundation, PBAF, Stillwater. I mean, it was quite an effort to put the actual facility together. And then we realized that it was great to have it, but accessing the care was really a challenge for locals because they had to call Texas Tech and make their own appointment. And it's usually about a 30-minute hold time. And also it was difficult without a staff person, on site to explain what the services were and what we were trying to offer to the community. So I started in July, and then we opened for regular hours on September 1st. And since that time, we've seen this sort of exponential growth of usage. People just coming in because there's somebody here and they can finally look around and the door is unlocked and open. But we also started offering things like during open enrollment for the healthcare marketplace, we had people come in who didn't have health insurance, and I would sit down with them and actually go through the entire process with them, so that we got about a dozen people enrolled in health insurance this year, which is a really big deal in a town this size where we have about a 23% uninsured rate and a 70% underinsured rate. So things like that and word of mouth got people realizing that, oh, the health center's open again. Now I do all of the appointment management. So if you need a telemedicine appointment, instead of calling Texas Tech and being on hold for 30 minutes, you just call or text me and I do it for you. Texas Tech is wonderful. Whenever we tell them something's not working well, we figure out a solution to it. And they hired someone who helps to manage their appointment calendar, and I can just contact that person directly, get an appointment, get the confirmation, get the information put in the system, and then the patient's just resting at home comfortably until I tell them it's time to come in. So that's worked really well. The diagnostic testing has been amazing. It's really affordable. The tests cost about $10. So even uninsured patients can afford to come in. The telemedicine for uninsured patients is $35. So for less than $50, a patient can come in, get an appropriate test, get an accurate diagnosis, and then all that's left is for them to access the prescription, which is an Alpine. We'll never have a pharmacy here, but everybody has to go to Alpine for groceries, so it's not nearly as difficult as having to leave work in the middle of the day for a doctor's appointment. So that's been wonderful. And the free clinics that we are doing, this next one is through the Texas College of Osteopathic Medicine. They've been incredible because they can come out here with an ultrasound machine. They come out with osteopaths who will do adjustments for people. They can do vaccines sometimes. DSHS can come out and do vaccine clinics, things like that. So our next step is to try to offer annual or biannual women's health clinics, mammograms, women's exams, things like that. And eventually what I would really love would be to have at least a part-time nurse on staff. I'm not a clinician. but I am legally allowed to do things like swab children for strep throat or do nasopharyngeal swabs for RSV, which I don't enjoy doing. I'm happy to do it as a stopgap, but I feel strongly that the people of Marathon sort of deserve someone who knows what they're doing a little bit better than I do. But the fact that we are able to access all of these services with a single staff member is incredible. And the more we learn about what we're allowed to do, and the more we see what the community's actual needs are and what services are going to be used, the more we're refining this model. And our hope is to make it a model that is transferable to other small communities like ours with variations where they can kind of take what we've cobbled together and discard what they're unlikely to use and add things in that they need. Um, and I think that's Texas Tech's hope as well, that we're sort of their pilot project for this level of telemedicine. So if anyone has questions,
Danielle, before we
Yes.
open it to the full group, can I get you to talk a little bit more about the Sisyphean task that you undertook with Quest Diagnostics so that you all did have the blood testing and also how that works logistically going to Alpine?
It does. Okay. It's still a bit of a Sisyphean task, as a matter of fact. We've made good progress. We're about halfway up that hill, but the rock seems to be getting heavier some days. So I can go into any Quest lab or LabCorp lab. I can just pop in and say, test me for everything. And if I have enough money to pay for that in cash, they'll do that. If I'm an insured patient, it's very different. There are time constraints on lab work. There are diagnostic constraints on lab work. So to get your lab work covered by an insurance company is very specific process. The first order of business for us with Quest Diagnostics was we couldn't set up an account without a clinician's NPI number, and that's sort of the identification number that doctors and nurses have. We have an NPI number being a health center, but they need an individual practitioner's one. So I went to Dr. Martin Ortega with the Texas Tech Clinic, who administers our telemed, and said, please, Martin, please, can I borrow your NPI number for our account? And he was like, well, you can't use it unless I'm writing a lab order, but sure, as long as you replace it with the clinician that's writing the lab order, fine. So we crossed that hurdle. We were able to set up an account. They had to sort of redo, we have paper forms to fill out when we do blood labs. So it's this piece of paper in triplicate. I swear it's on a dot matrix printer that we have to fill out. And then we send it off with the samples. And Dr. Martin Ortega's NPI number's on there, and I literally have to cross it out and handwrite in the number of the clinician that's ordering the labs. So that was the first hurdle, and we got set up with them. And then it was getting a phlebotomist. Apparently, I am legally allowed to draw blood from people with no actual training or certification, but I've decided I really don't want to do that. So we're fortunate that a local woman has just finished her certification at Midland Hospital as a phlebotomist. And when she comes to visit her family, she's going to be drawing the blood for us and handling that because she knows much better than I do what to do. So we had set up our first blood lab clinic was going to be February 20th, and I had about half a dozen patients scheduled to come in. And I said, all you have to do is have your doctor send me the lab order. And I even got a very expensive HIPAA encrypted fax line so that they could legally and correctly send me the lab orders. And unfortunately, none of the doctors would send the lab orders over. So after discussing with several of the local doctors, we're trying to do this to make it easier for people. The general answer that I got as to why they didn't want to do it was because they want to see the patient, then order the labs at a second appointment, and then go over the results at a third appointment. And if I were doing labs here, that's 3 appointments that they're going to lose. They'll just get one to go over the results. Another one told me that it would take him 15 minutes to look up what labs the patient needed, and he just didn't have the time, which I understand because we have about a 1,500 to 1 patient to doctor ratio out here, and 15 minutes is a pretty big deal for them. So we've just found a solution to that. I talked to the Texas Tech Odessa clinic again and asked them if we could set up telemed appointments for these patients specifically for generating lab orders where they can go in, get a full checkup over telemed. The telemed doctor will fax me the lab orders, and then they can come and get their labs done here whenever they want to. And that way people don't have to take 3 separate days off work, 3 separate co-pays, 3 separate drives to Alpine. That's extremely cost prohibitive for some patients, and for others, it's just time prohibitive. So we are rescheduling our first blood lab clinic for early March. And I would love to update everybody on how it goes. I think I might get some done myself just to make sure the system's working properly. So.
And then I'll ask you one more question, and then, which is, can you talk about what some of your needs are as you think about continuing to expand services or just fulfill what you're trying to do for the community? And then I would love for Sandy to weigh in on that as well before, and then open it up to everybody.
Absolutely. Our biggest need right now is to ensure that we can afford a single staff member. Our operating costs up until September 1st of 2023 were about $30,000 a year for the facility and maintenance. And that was covered by an endowment, I believe through Stillwell, and by the Marathon to Marathon, which is a great event and generates about $15,000 a year, all of which comes here to the health center to help support it. So it was great because it was self-sufficient, but almost no one was using it. So it was a bit March of Dimes for our taste. We wanted to make sure that we could actually provide services that the community needed and could access. And when we opened our doors for regular hours September 1st, that came with it employment costs. So what we're looking at right now is how to pay for me and any other staff member that steps into my position, or someday I envision needing 2 people in here. Some days I think I already do. We've seen such a huge uptick in usage. I sometimes have 3 or 4 telemedicine appointments a day, and it's very difficult for me to administer this organization as well as be treating patients. So like I said, I'd love to have a nurse practitioner in here even a few days a week. So that's a primary need right there, is just to make sure that we can afford the people that we need to keep this running. Another need is always is networking. I want to know every organization within 300 miles of here and what they do and what they have and what they need. Because I think that in a small rural town that's so remote, that's so low income, our biggest strength is the ability to work with all of the people around us. Like, how good of a neighbor are you? My neighbor is an amazing welder, and I'm a really good editor. So we trade services all the time, and we fill in each other's gaps. My weaknesses are his strengths. And this health center has sort of evolved very much along those lines. Instead of looking at, oh, well, we don't have this and we don't have that and we don't have this, we've gone out and said, well, who has what we need? And how do we make them part of the organization and a true stakeholder? Our community's been amazing in that way. They have become true stakeholders. They're great critical friends. They tell us, I tried this and it didn't work. And it tells us what we need to focus on to fix those problems. So I definitely want to connect with all of the healthcare organizations that I can to see what they're doing and to learn from them. Oh, you're muted,
Okay.
Kelty.
Thanks, Danielle. Sandy, did you want to add?
Yeah, always. Thank you, Danielle. It's just, I'm so happy to be a supportive member of the community here of the health centre. And I would like to just add an adjunct to what Danielle said. You know, there's work that goes on here that Danielle didn't mention around prevention. I don't think healthcare on its own can just be about treatment. I mean, that's just doesn't make sense, you know. So Danielle, for instance, does prescribes dietary programs for people in the community to go and lifestyle changes, and it's not just like it's an abstract thing, because they can have the metrics measured at the beginning of any program. They can have it done every month or 8 weeks or whatever, and they can see the improvements in their health. So I think it's important to just flag that up, Danielle, that we're about prevention. It's not just about treatment. The stuff around that insurance, helping people to access insurance, is absolutely profound work, in my opinion. Danielle says that she can get people signed up to health, good value health insurance within half an hour. And that's like accessing Obamacare as well, cutting out the third parties. So I think that speaks to things, you know, issues of like equity around, so it's equity, so health, and also health literacy, not just understanding health issues on a personal basis, but understanding the healthcare system, which bamboozles me, you know. So that work that's going on one-to-one personal appointments, I think is really profound. We've just acquired a new defibrillator, so that's going to take a very high profile pride of place outside the building here. So that's and we'll do an awareness raising exercise on that, and that's about emergency equipment readily available for not just locals but for the community as well, if we can flag that up in the hotel guest services directly and things. Community collaborations that Danielle spoke about earlier on, I think there's a huge opportunity. You know, some of the challenges here are around, if I could say, it's about sustainability. It's Danielle that's running the show. It's an open door policy. Danielle's phone goes off, but all others, and that's fine. But any service that's it's got to be built on a strong foundation. And my suggestion is that we look at the area of sustainability. And that might be like picking up opportunities and how do you engage further the community. Some of the relationship building that's been done here has been great. There's a local person here who is a digital, he's a health specialist in the area of patient privacy and things. So he's helped supported Danielle to work out the protocols around that, and she can just call him at whim if there's anything around HIPAA that she needs to know. So I see an opportunity for volunteers here as well, and get the community involved in the running of that. So that's some of the challenges, some of the opportunities, and I think that's all I wanted to say just now.
Can you all talk a little bit about the quilters?
The quilting group in Marathon, yes, they used our community room, which is available to anyone in the community for a meeting space. The quilters are lovely, and in fact, we in years past have had a massive quilt show every October here, and it hasn't happened, I think, since COVID. But yeah, we made our community room available for them as well, so that they could have an air-conditioned space to get together and do their sewing.